First, don't be afraid to intervene. In social psychology, we study something that's known as the bystander effect. The bystander effect says that sometimes we might see something, hear something that makes us uncomfortable, and we may not intervene, even if it might be an emergency situation. This is because we might believe that it's not actually an emergency and decide not to intervene based on that, or because we think that someone else is going to help. So the first step is be an active participant. Don't be afraid to ask questions, and don't be afraid to intervene if something does seem off to you. In social psychology, we study something that's known as a belief in a just world. Belief in a just world suggests that we all desperately want to be able to believe that the world is a good place, and that if you behave in good ways, good things will also happen to you. Unfortunately, this means that we might be more inclined to blame people for bad things that happen to them. Both in your own life and in personal conversations with others, understanding that propensity for belief in a just world can help us to offset victim blaming that we see in society. One crucial aspect that you can take as a support system for someone who is a survivor is to recognize that tendency for people to blame the victim and help to offset that wherever you can.
The initial conversation that you have with someone is bound to be difficult. You're likely to feel a complex set of emotions, fear, anger, sadness, when you hear about someone else's traumatic experience, and all that is okay. You feel how you feel, and you shouldn't try and deny how you feel. What I would encourage you to do is try and set aside your own feelings in the moment and try and focus on the feelings of the person you're trying to support. It's hard, but I think that's really, really valuable to try and make yourself available to that person. I think once that conversation's over, it's probably important for you to seek support yourself, again, because it's going to be a difficult experience for you as well. But it's important in seeking that support that you don't compromise the sort of anonymity of the person who disclosed to you.
So I think what I would recommend is to be there as a support for your friend or loved one and move with them at their own pace as they're coping with their experience of a trauma. I would strongly recommend against you feeling like you need to force them to talk about their experience and their trauma, or feeling like you need to be the one to process that trauma with them and for them. There are psychologists and psychiatrists and mental health professionals who spend years and years and hours getting the clinical training that they need to treat and address trauma exposure, trauma-related anxiety, and post-traumatic stress disorder, or PTSD. And so I would recommend letting them do their job that they've spent a lot of time getting the training to do. That being said, I think that you can have an important role as supporting your friend or loved one and helping your friend get access to resources and these more formal treatment options if that seems like something that they might need, but you not being the one to provide that mental health treatment for them would be a strong recommendation that I have. But I think that helping support them get connected to resources and to mental health treatment is a really important role, and one that you could play as their friend or as their loved one.
I would encourage you to devote that energy, instead of the planning, to really just listening to the person that disclosed to you and trying to figure out what it is that they need. And they may not be sure about what they need. And you might try different things, or they might encourage you to do something, and then they might react negatively to it. And rather than you getting upset and getting your feelings hurt, which would be understandable, I think it'd be better to say, okay, I understand. Thank you for telling me. I'm going to try and do better. Again, it's hard to do that kind of thing, but I think it's important moving forward.
Remember that if someone has experienced trauma, that often involves a forceful removal of their personal autonomy and their choice. Part of being a support network for a survivor means re-empowering them with their own autonomy and their own choices. This might look like simply a listening ear, giving them the choice of what they would like to eat that day, or it might be helping them take action related to their trauma. Just remember that this is going to be a long road for them, and allow them that time and space for whatever their recovery looks like.